Hello, everyone, and welcome to an International Boarding and Pet Services educational webinar. My name is Carmen Westenbeck, and I'm the Executive Director for IBPSA. Before I introduce our guest speaker today, there are a few items I would like to mention. First of all, this webinar is being recorded, and it will be available on the IBPSA website. And for our members, it will be available in the video library on the member dashboard. During this webinar, you will be able to ask your questions using the question box on your GoToWebinar app. So take just a moment to look at your app and get acquainted with where the question box is. Charlotte Biggs, IBPSA's Chief Operating Officer, and her assistant, Nicole Oates, will be monitoring your questions today. At the appropriate time, your questions will be asked of the guest speaker by Charlotte and Nicole. Should we run out of time to get all your questions answered, not to worry, as we have a contact email for you to use for those questions to be emailed to. And we will be displaying that email address during our question and answer time today. So once again, I welcome each of you to the IBPSA educational webinar. Today's discussion, of course, is about canine influenza and is sponsored by Merck Animal Health. IBPSA would like to remind you that you should consult with your trusted veterinarian professional as it relates to canine influenza and the pets that you either own and the pets that are in your care. So let's get started. Our guest speaker today, Dr. Melissa Bourgeois, graduated from the University of Florida College of Veterinary Medicine in 2007 with a DVM and in 2010 with a PhD in veterinary medicine, focusing on gene expression in equine hosts following the West Nile virus infection. From 2010 to 2012, Dr. Melissa served as an Associate Service Fellow at the Centers for Disease Control and Prevention, conducting research into methods to combat highly pathogenic avian influenza. Dr. Melissa became a diplomat of the American College of Veterinary Microbiologists in Virology in 2011 and Immunology in 2013. From 2012 to 2015, Dr. Melissa worked for Merck Animal Health as a Technical Services Manager serving the Atlanta region. Since July 2015, Dr. Melissa has worked for Merck Animal Health as a Senior Drug Safety Specialist. Dr. Melissa also works on the weekends in a local clinic. In her free time, she enjoys hiking, backpacking, running, and spending time with her husband, son, horse, and cats. Dr. Melissa, thank you and welcome to IBPSA in our webinar.
Thank you very much, and thank you everyone for attending today. I know everyone's got very busy schedules, so we really appreciate you coming. So I guess with no further ado, we'll go ahead and get started. Okay, so first, we just want to give a brief introduction of what canine influenza or canine flu is. There's really two what we call strains of flu virus that affect dogs in the United States right now. The first is kind of the older strain. This is the strain that was first detected in 2004 in some greyhounds at a racetrack in Florida. And since then has sort of spread throughout the United States and has been detected in many states. And I'm going to show you some maps in a little bit. Basically, this strain of influenza jumped from horses to dogs originally. It's very uncommon, really, to have a mammal-to-mammal transmission and for the virus to continue to propagate in the mammal that it jumped to. So it was kind of an unusual event. We've actually gone back and looked at serum that was banked in some racing greyhounds as far back as 1999, and we think the jump occurred back in the late 90s, most likely. Now, there's a new strain of influenza, new relatively speaking. It's called H3N2, and we first detected this in 2015 in the United States. And I'm going to talk a little bit more about that outbreak and also what's going on now, which I think is probably the major reason that a lot of people are here. We know that the H3N2 virus was originally from South Korea, and it jumped back in around 2006 from birds to dogs in South Korea. So we have, like I said, these two strains, H3N8 and H3N2, that are now both circulating in dogs. And the H's and the N's, in case you're ever curious, they refer to proteins that are on the outer surfaces of the virus. there's a lot of H's and N's, to 16 N's actually. And so there's, a lot of variability in the flu virus. But as far as we know, the only strains that are actively circulating in the canine population, in other words, aren't just jumping to dogs from random events, are the H3N8 and the H3N2 viruses. So a little bit more on this H3N2. It was first identified in the U.S. in Chicago, Illinois in March of 2015. And we started testing a lot of dogs at that time because we knew, we had something that was pretty virulent. We suspected something new. And it was confirmed as H3N2 by Cornell and University of Wisconsin. The second major outbreak for the H3N2 virus occurred in Atlanta, Georgia in May of 2015. So you can see within 2 months it had already jumped from Chicago to Atlanta, and it actually spread across many more states as well. And it's really been circulating throughout the U.S. since. So what happened recently? Well, we've had the H3N2 circulating since that March of 2015 date, but in May of 2017, there were 2 dog shows. There was one in Perry, Georgia, and one in DeLand, Florida, and there were some infected dogs. They went to the dog shows, and it started propagating, and it has now spread from those dog shows to a number of different states. And this map with the red states kind of shows which states it spread to since the dog shows in Georgia and in Florida. So now this is an up-to-date map of where both H3N2 and H3N8 or both strains are. So the green shows the states where we've detected both H3N2 and H3N8 at some point. Not necessarily concurrently, but at some point. The H3N2 is the light blue. That's where we have H3N2 strains only, and that includes Minnesota, Michigan, Louisiana. And then the dark blue is where we've detected H3N8 strains only. And there's a number of states that you can see where we haven't yet detected H3N2. But I do recommend you view all these maps with caution because we're not testing the entire dog population every time they get respiratory illness. Our maps are only as good as the testing. So if we're not testing for it, we're not going to find it. So always view maps, of course, with some caution. Okay, so which dogs are at risk? I get this question a lot, and my answer is any dog that is going to interact with another dog, to me, is at risk of influenza. And many people think, well, that's just going to include dogs that go to the dog shows or that board or go to doggy daycares, definitely, rescue groups or shelters, anywhere you're going to be around a lot of other dogs. And yes, that's true, absolutely, but how often does someone walk their dog in the neighborhood and it sniffs noses with the neighbor's dog? So to me, any dog that's social, any dog that's going to be exposed to another dog is really at risk. Unless you've got, a little dog that stays at home and never goes outside and uses the litter box, really any dog that's going to be social and interact with other dogs is going to be at risk for influenza. So how is the flu virus transmitted? There's a couple of different ways that the flu virus can be transmitted. One way is what we call more of a direct contact, where the dogs actually touch noses or secretions from the dog's nasal cavity or oropharyngeal cavity are either coughed or sneezed out containing the viral particles. So aerosolization and direct contact are two of the most common ways. And an average 50-pound dog can actually sneeze, and we can detect droplets as far as 20 feet. So they can spread these viruses pretty effectively just through a sneeze or through a cough. The other way of transmission or mode of transmission that we tend to see is indirect contact. So anything that the dog may have sneezed on and then gets transferred to another, let's say, kennel. For example, let's say there's a stuffed teddy bear and the dog sneezes on it, it gets put in another cage and another dog comes in contact. And also, there's us. When we handle dogs who are infected with influenza, we get the influenza virus on us, on our hands and on our clothing, and we are some of the most common spreaders of the flu virus between dogs. So I often get the question, how long does the flu virus survive in the environment? And it's a little bit of a tricky question because you can find, certain flu viruses in bird feces, for example, that can survive for extended periods of time, like up to 6 months. But for canine influenza, under the conditions that we typically think of, so for example, your grooming facilities or your kennels or your clinics or in your household, we know that influenza virus can survive on surfaces up to 48 hours. And depending on the type of surface, that can be very variable, but typically up to 48 hours is what we're going to see survival. On humans, on us, as we're going in between dogs and we're taking care of dogs or we're petting dogs, we can actually see the flu virus survive for anywhere from 12 to 24 hours on our clothing and our hands. So you can see, think about how many dogs you might see in an 8 to 10 hour workday. You're going to, if you don't wash your hands, and if you get the flu virus on your clothing, you're going to be a great spreader of the influenza virus. Okay, so just a little bit of a difference between the two flu strains. The H3N2 strain, now remember that's the strain that's been around since at least 2004, probably before that. We know that that strain is not shed that long. It's shed for about 5 days after the onset of clinical signs. So after the dog starts showing that coughing, sneezing, the illness, it's going to be shed for about 5 days. H3N2 is very different. This virus is actually shed for up to 24 days after the onset of clinical signs. So why is that important? Well, think about the fact that these dogs, they're going to be recognized as having respiratory disease. They're going to be treated. They're probably going to look better around 1 to 2 weeks. So people are going to start taking their dogs out. They're going to bring them to the pet stores, to the daycares, to the grooming facilities. And that dog is actually still shedding the flu virus. So H3N2 can be infectious for quite an extended period of time. With H3N8, we do see fewer viral particles shed, which just means less virus is shed by the dog compared to H3N2. And we also see a slower onset of disease with H3N8 compared to H3N2. In fact, we'll see H3N2 start about 1 to 3 days, sometimes after exposure to the virus. Okay, so what are some of these clinical signs that we might see if a dog does get infected with influenza virus? They're what we call nonspecific clinical signs. So what does that mean? It means that there's a lot of different viruses and bacteria out there that can cause these signs. And just by looking at a dog with these signs, I cannot tell you what pathogen that dog has or what is causing that dog to be sick. These include coughing, sneezing, discharge from the nose and eyes, fever. We tend to see fever a little bit more with canine influenza compared to some of the other diseases that affect the respiratory tract of dogs, but we can see fever with other diseases as well. Lethargy, that just means, they're really quiet, they're not wanting to play, they're not wanting to get up and move, maybe they don't want to go for a walk. Loss of appetite. Pneumonia, of course, it needs to be diagnosed. And we have seen some cases of death with the H3N2 and the H3N8 virus. So the key is when you start seeing these clinical signs, immediately advise people to bring the dog to the vet, or if it's your dog, bring the dog to the vet, because we really want to get a handle on the disease quickly. We want to test so we know what the dog actually has, so we know how to treat it. And we want to institute precautions and treatment measures that are going to protect other dogs and help the dog get better. Okay, so this is just a slide just to show you that there's a lot of different pathogens or viruses and bacteria that actually cause disease out there in dogs, that cause that respiratory disease. You can see canine influenza virus is up here, but there's there's 7 different viruses that we know of at this point and 3 different bacteria that we know of at this point. And there's actually more. This slide is not completely comprehensive. So just keep in mind, if you have a dog who's sick with upper respiratory disease, it doesn't necessarily mean that it's the flu. Or it also doesn't mean it's only the flu. It could have other pathogens as well. Okay, so I know this slide's a little bit busy, but the reason I wanted to put it up is I think it has some valuable information, especially if you've had a recent exposure to one of these respiratory pathogens in your facility. So the 2 things I want you to really pay attention to are the middle, survival in the environment, and the right column, post-infective shedding. And you can see down here, we kind of talked about H3N8 and H3N2. 12 to 24, up to 48 hours is how long they survive. Post-infective shedding, so after the onset of disease, H3N8 shed for about 5 days, H3N2 for about 21 days. But there's some other respiratory pathogens up here to think of. I'm sure you guys have all heard about Bordetella. That's actually it can survive in the environment for 1 to 2 weeks. And without treatment, without antibiotics to kill that bacteria, it can be shed for up to 3 months. So that's a pretty extended period of time if you think about it. Adenovirus type 2, this is a virus that we do have a vaccine for. It can survive in the environment for over 2 months, and it can be shed for up to a year. So, it's not just flu, and there's some other pathogens out there that you really need to be careful about, and you need to send those dogs to the veterinarian to really understand what's going on. Okay, so let's say you do have a dog that comes in with respiratory disease into your facility. What are you going to do? What's the next step? Well, preferably, if you know you've got a dog coming in with respiratory disease, you want to try and either not let that dog into your facility, or you want to do whatever you can to prevent exposure from other dogs. Okay, so the first thing you're going to do with decontamination is you're going to remove organic debris. So what does that mean? Unfortunately, even if you're using bleach, if you have organic material on the surface, that bleach is not going to eat through that organic material. So if you have dog hair, if you have nasal secretions, if you have feces, if you have anything in that cage that is physical material, bleach is not going to get through it, no matter how thin it may seem. Even grease, bleach can't get through. So the first thing is you want to remove organic debris, and you're going to do this by sweeping. You're going to do this by just getting the material out of the cage or whatever surface it is you're disinfecting. The next step is to clean, scrub with a detergent or degreaser. What is that? Basically, that's something that has soapy activity. So dish soap, Dawn dish soap, for example, has great detergent degreasing activity. Then you're going to rinse, and at that point is when you apply the appropriate disinfectant. So if you're using bleach, if you're using hydrogen peroxide, potassium peroxymonosulfates, whatever you're using, you need to go through the removal of organic debris and the cleaning stage first, then apply the appropriate disinfectant for the appropriate contact time. So many of us don't realize that just taking a spray bottle of whatever disinfectant we're using, spraying down and wiping, that actually isn't going to do anything. It's not going to kill a lot of the pathogens that are on the surface. You need to allow that disinfectant to sit for anywhere from 5 to 10 minutes, depending on what you're using, and we'll go through that in a minute, for 5 to 10 minutes in order to inactivate any of those bacteria or viruses that might be on the surface. Then you want to rinse. And finally, you want to dry. And drying actually can be important because that moisture can hold on to some pathogens. So remember, remove organic debris first, then clean, then disinfect, rinse, and dry. Ideally, you probably do want to use a sprayer if you can. Why is that? If you're using a mop, unfortunately, once that mop comes in contact with the infected material, you're going to contaminate your disinfectant. So ideally, if you can use a sprayer, we can't always do that, especially if we don't have drainage and it's an indoor facility. So if you are going to spray, just be careful. Don't aerosolize the disinfectant or the pathogen, because you can actually spread the pathogen around. Mopping, wiping, like I said, not ideal, but oftentimes necessary. It's very advantageous where there is no drainage. And I really like what's called a 2-bucket system, where you have a bucket of clean water and a bucket of disinfectant. With the mop, you're going to put it in the disinfectant. You're going to take it out, squeeze out the excess disinfectant, rub the area or mop down the area where the contamination occurred, then put it into the clean water, squeeze it, put it back into the disinfectant. So it's like you have a rinse stage in between mopping up the contaminated area and dipping back into the disinfectant. So that can help. Okay, so hopefully some of these names are pretty familiar to you. These are different disinfectant types that are available. Bleach, of course, very, very common. Sodium hypochlorite is the most common form of bleach that we use. It's inexpensive. You do want to dilute it, and I'm going to show you why on the next slide. And that's at about 1/2 cup to gallon of water. It is inactivated with organic material, and as you guys know, it is very irritating. If you're in a room that's enclosed with bleach, you can't smell for a little while afterwards. It's corrosive to metal. It can actually cause metal to break down and to rust. It is light sensitive. So if you aren't storing it in a light, tight container, the UV radiation and the lights can actually break down the active component. In the column there on the right, naked viruses. Now, it's not really pertinent to influenza. Influenza is what we call an enveloped virus, which means it's very, very easy to kill. In fact, soap and water will do a good job against influenza virus. But there are certain viruses. If you remember that chart that I put up and I called your attention to adenovirus type 2, that virus is actually shed for a year and it survives in the environment for greater than 2 months. That is a really hard virus to kill. It's what we call naked, a non-envelope virus. So you need to use either bleach, potassium peroxymonosulfate, or hydrogen peroxide to kill adenovirus. Potassium peroxymonosulfate, this is things like trifecta and Virkon. It has some detergent activity, but it is going to be a little bit more expensive. It does work against your naked viruses. Hydrogen peroxide, this is things like Excel. It has a shorter contact time. So bleach and potassium peroxymonosulfate, they actually require a 10-minute contact time. It's not just spray and wipe, and it's not even spray, sit 5 minutes, and then wipe. It's actually a good 10-minute contact time. So hydrogen peroxide actually is only a 5-minute contact time, which is kind of nice. It has some detergent activity. Doesn't really have an odor and low tissue toxicity. It is a little bit more expensive, but it's going to work against even your toughest to kill viruses. And then there are quaternary ammonium compounds. Those are things like Rucol, Tenasol, A33. They don't work against your non-envelope viruses, but they do work against things like influenza virus. So they're effective in that regard as well. And this is just something to realize about bleach that many of us may not. Bleach comes in the sodium hypochlorite form that you see right here, NaOCl. You have to dilute it in water because then it forms active compounds of HOCl and sodium hydroxide right here. However, within about 7 days after dilution, bleach will break down into sodium, chloride, and hydroxyl radicals, and it won't actually have any antimicrobial or bacteria or virus killing activity at that point. So remember, it is sensitive to light. It does break down with time after you start to dilute it. So you really want to store bleach in light, tight, airtight containers and really dispose of them after about 7 days of non-use. So you want to be mixing bleach fresh every week. And the other thing to keep in mind with bleach is that the original container that you purchased does actually have an expiration date. So if it's a container of bleach that's been sitting around for 3 years, probably not good anymore. So I definitely recommend getting a new container. So a few rules about disinfection. Ambient conditions do matter. So what does that mean? That means that how the room is actually will affect the survival of the microorganisms, those viruses and bacteria, as well as how effective your disinfectants are. So UV light can actually kill a lot of microorganisms, but UV light actually has to be able to access the microorganisms, so there can't be any organic material. Temperature and humidity are big factors in the survival of influenza virus. Many people think that we see more flu virus in the winter because more people are indoors and together. Well, one of the big reasons that we see influenza virus around in the winter is that the humidity in the air is very low. The moisture content of the air is very low, and influenza virus actually spreads better with low humidity. Now, something I also didn't talk about earlier about how easily influenza virus spreads and how dogs are infected. We don't really have the exact numbers for H3N2 yet. We do know for H3N8 that it has what we call 100% morbidity, which means that all dogs who are exposed are going to become infected. Now, they may not all become sick, but they are going to be actively shedding that virus, even if they don't have clinical signs. So that's also something to keep in mind. It's very, very infectious. Concentration of disinfectant certainly matters. So does the adequate contact time, and we talked about that a lot. Use detergent initially, storage containers, how you store things. And then the type of surface that you're disinfecting matters as well. Hard surfaces definitely are a lot easier to disinfect than your softer surfaces. And you never, ever want to mix a disinfectant unless you're instructed to do so by the manufacturer. So never mix disinfectants together. Now, when you are cleaning, a few things to keep in mind. Yes, of course, you want to clean those cages, if you have cages in your facility. But don't just clean the floor and the walls of the cage. Clean the ceiling. Clean the back of the bars. Clean the hinges where you release the lock. Make sure that you're cleaning the entire cage, because these influenza organisms, if they get on those surfaces and they're not adequately disinfected, again, it can survive for 48 hours, so you're going to infect the next dog. Toys, bowls, bedding, all these things that dogs might come in contact with, the floor outside the cage, the floor throughout the facility. Do you have a waiting room where the dog might have sat for a little while? Well, now that waiting room is actually infected, right? What are the kind of chairs do you have in your waiting room? Are they cloth or are they hard surfaces? That cloth is going to be really hard to disinfect. Any tools that you might use, whether you're a boarding facility or a grooming facility or whatever tools you're using, make sure those are disinfected as well. The waiting room, the dog runs. You have somewhere where you let the dogs out and other dogs go as well. Yard, it's going to be really hard to disinfect a yard. I will say that. Carriers, offices, storage areas. Keep in mind, if you handle these dogs that have respiratory disease and you get the flu virus on you and then you go type on your keyboard or you go to an area where you might store equipment or food or supplies and you handle things without properly disinfecting your clothing or your hands, you've now introduced influenza virus to those areas. Ventilation and heating ducts. Remember, the average 50-pound dog can sneeze 20 feet. These influenza particles can be picked up by the intakes, and it can spread throughout your facility through ventilation and heating ducts. And then something that we never really do a good job of disinfecting are the things that we don't think about, the frequently handled items. When was the last time you disinfected your car keys or your cell phone, doorknobs, light switches, pens, clothing that you're wearing if you're wearing a necktie. So there's a lot of different things that need to be disinfected. Just think when you're walking through your facility, if you've had these respiratory cases come, where could those particles with the flu virus have gone? Proper containment. the most common spreaders, I hate to say it, are us. So make sure you're always washing your hands, you're changing your clothes, because we are the most common spreaders of dog flu. Okay, so I'm not sure if at your facility you're going to have isolation and quarantine capability. So I'm just going to kind of briefly go through some isolation and quarantine situations and scenarios that you want to consider. If you've got a dog that had respiratory disease that came in, let's say someone said they're coming to your facility and they don't tell you that the dog is sneezing and coughing and it gets there, consider that that dog is sick, and all dogs who are potentially exposed to that dog or to where that dog has been should be considered exposed and potentially shedding. If you are going to set up a situation where you're going to isolate or quarantine, you want to use a physical barrier if an isolation room is not available. And by isolation room, of course, there's all the way to the fancy isolation rooms with their own air filters, HEPA filtered air, all the way to just a separate room where other animals don't go, where you can put these dogs that have flu. So something is better than nothing. And if you don't have even that separate room, a physical barrier is wonderful. So, you know, if you've got a series of cages, one of the things that I love is a clear shower curtain. Hang a clear shower curtain in front of that cage, and that way when that dog sneezes, it, yes, gets the cage, but it hits the shower curtain and doesn't go out into the rest of the room, and the shower curtain can be taken down and easily disinfected. So use physical barriers if you need to. Preferred separate ventilation, that's not always possible, but if you have it, that's wonderful. And separate entrances. Now, one of the big things that we saw, you know, in the flu outbreak here in Atlanta and in Chicago in March to May of 2015 was all these dogs with respiratory disease coming into the vet clinics and infecting other dogs. So a lot of clinics, what they would do is they would either set up separate entrances for respiratory cases. So if they had like a dog and a cat entrance, it would all of a sudden become a respiratory disease and a non-respiratory disease entrance. You know, if you can't do that, bring the respiratory cases in the back. Just basically keep them away from other dogs. And ideally, don't allow dogs who are showing respiratory disease into your facility if you can help it. If you can't help it, set up isolation and quarantine and keep them separate from other animals. Now, if you are going to have an isolation and quarantine situation, there's certain what we call a PPE or personal protective equipment that is recommended you use. Ideally, with flu, the most important things for preventing it from spreading to other dogs are going to be double gloves, a gown, and some booties. So something you can flip over your shoes or dedicated shoes. I personally like dedicated shoes because, you know, if you set up a foot bath, we never stand in foot baths long enough. So I prefer to have shoes that are dedicated to the room where I'm going to conduct the isolation or the quarantine. Masks and hairnets and dedicated scrubs, those are all nice. I don't think they're necessarily essential, but they can be useful. So basically, if you're going to set up an isolation and quarantine facility, this is kind of how you want to do it. You want to have a clean room or a clean area, and this is where your personal protective equipment is stored. So you'd come here, you'd get dressed in your gown, double gloves, and preferably dedicated shoes as at a minimum. If you're going to do the hairnet and the mask, that's wonderful as well. You're going to go in, you're going to take care of the animal. You're going to have a bottle of 70% ethanol, which as you're leaving, you're going to spray your outer gloves with, take off your outer gloves and throw them away in a biohazard container. You're going to throw away your gown, or if you want to reuse it, that's okay. Just hang it up in the room here. Then you're going to step out. You're actually going to spray it on again with 70% ethanol. You're going to take off those dedicated shoes, store them in your cabinet, strip all your other stuff, and throw it away. And ideally, if you can, the airflow is going to be into the room where you've set up the isolation or the quarantine. Okay, so just a few things on clothing and hand washing. Washing clothes, you want to really use a hot cycle. You know, depending on where you are in the country and what season it is, the water temperature can be quite variable coming in from outside. So, you know, in the winter, technically the cold cycle is around 60 degrees Fahrenheit, but in the winter it can be much colder than that. And with influenza virus, you really want to use the hot cycle if you can, because we know that it's at least 130 degrees Fahrenheit at some point. Usually they're sustained at 118 or higher for 20 to 30 minutes. So that will be enough to kill the flu. Ideally bleach. If you can't use bleach, make sure you're using some kind of a detergent. And then hand washing, you want to scrub at least 20 seconds and dry. And 20 seconds is a lot longer than you think. It is singing your ABCs or happy birthday, the entire thing. So it's longer than it seems. The other thing about clothing washing, of course, is you want to dry it if you can. Okay, so again, if you've got respiratory disease, we're not going to talk about treatment here or diagnostics or anything like that. It's kind of outside the scope of this lecture. If you have a dog with respiratory disease, please bring it to your vet so that they can do the diagnostics and the treatments that are necessary. But I do want to talk about how you can prevent really influenza virus as well as any of these other respiratory diseases. Not all of them. We don't have vaccines for all of them. But for a good number of them, is vaccination. And the thing about vaccination is, as humans, we don't like to vaccinate for a disease that we don't see. But unfortunately, that's how vaccination works, right? We want to vaccinate when we're not seeing disease to allow the dog to mount an immune response so that when the dog is exposed to disease, they're actually protected. So vaccination is a preventative measure. It is not a treatment option. And there's a number of different ways that vaccination works when we're talking about upper respiratory disease. And CIRD means canine infectious respiratory disease. There's two things it does. One is it protects the dogs that you're actually immunizing by reducing the duration of disease and the severity of clinical signs. And it also protects surrounding dogs by reducing shed and spread and promoting what we call herd immunity. So once you vaccinate, depending on the disease, a certain number or percentage of animals in the population, you should drive down the numbers of cases of disease to the point where you don't really see it that much, hopefully. So the only prevention really is vaccination. And again, I want to stress, it is not a treatment option, it is preventative. And I can tell you as someone who lived through the original outbreak in Atlanta in 2015, I wish we'd had a vaccine at that time. We didn't. And, you know, when you have a situation where you don't see the disease and then the disease is introduced into your population, there is not enough time for the dog to form an immune response. As you can see down here, vaccinations must be performed before you see disease because it is what we call a killed vaccine. You actually need 2 doses, and it has to be 2 to 4 weeks apart. And the reason it needs to be 2 to 4 weeks apart is to form a good, what we call memory immune response, so that the next time that dog sees that disease in 6 months to a year, its immune system still remembers what that disease is. So you need those 2 doses, 2 to 4 weeks apart, no sooner, no later, and then you start to get an immune response 2 weeks after the 2nd dose. So if you think about that, 2 doses, let's say you go 2 weeks apart and then you get immunity 2 weeks after the 2nd dose, that is 1 month before the dog is protected. If you go on the later end of that, the further end of that with the 4 weeks apart, that is 6 weeks before the dog is protected. So again, vaccinate before you see disease. Don't vaccinate in response to the presence of disease because you're not going to be protected. And then we do actually have a 2-way vaccine, and I really recommend using what we call, it's called a bivalent because it has both the H3N2 and the H3N8 strains in it. I know right now what we're picking up a lot of, especially in those dog shows that occurred in May of 2017 in response to those, is H3N2. But H3N8 is still out there. And again, you want to vaccinate when you're not seeing disease. So I really recommend the Bivalent Vaccine. We're actually the only company at this point who has the Bivalent Vaccine. It is an inactivated virus for dogs 7 weeks of age or older, and 2 initial doses 2 to 4 weeks apart. An annual booster with 1 dose is recommended. And I do recommend making sure that you're on time with annual boosters because we can start to see a decrease in the immune response if you're not careful. Okay, so in summary, there are 2 strains of influenza that are known to infect dogs, H3N2 and H3N8. We've detected either or H3N2 or H3N8 in 46 states at this point. So there's very few states that we haven't detected them in. All dogs who are exposed to other dogs are at risk. So any dog that is going to be social and is going to see another dog is at risk. Transmission is direct or indirect contact. We know influenza can survive in the environment for up to 48 hours on us, 12 to 24 hours. Clinical signs are nonspecific. There's a lot of other diseases out there, so bring your dog to the vet to make sure we know what kind of virus or bacteria we're dealing with. Practice good disinfection, appropriate cleaning, disinfectant contact time. Clean all areas where the dog went. Proper isolation and quarantine, and again, vaccination is key to prevent disease. Okay, so with that, I'm going to go ahead and turn this over to Ms. Carmen Restenbeck, and thank you everyone so much for attending, and I think there'll be a little bit of time at the end to answer some questions.
Thank you, Dr. Melissa, for being willing to share your experience and your expertise. So while we're waiting for those questions to be loaded, I would like to share with you that IBPSA has developed a PDF document for our members. And I believe that's our next slide. Yep, there it is. Okay, so for the members, you can download this PDF in the member dashboard and just log in, go to the file library, and then you'll find dog flu facts. So this is for you to hand out to your clients also. I would like to thank Merck Animal Health for giving us some basic facts for us to use as we develop this sheet for our facility members, our pet care service provider members. And then for those of you who have joined us today but are not IBPSA members, we have a special rate just for you as a new member. And we will be sending out, after this webinar, a special invitation to you to join. They'll have this information on there. But our special rate is giving you 2 months free on a 1-year membership. So we hope that you will join us. We have over 40 hours of webinars. That's the same quality of what you've experienced today with Dr. Melissa. Our webinars cover everything from operations, protocols, marketing, apps. Do you want to get an app for your facility or not? So we try to cover all areas of a small business for pet care service providers. And those are all free to our members. So we record all of our members and place them in our member dashboard. So lots there to choose from. So then, and last, we invite each of you to our 5th annual conference and trade show in Jacksonville, Florida. And it's October 3rd to the 5th. And for those of you who are looking for continuing education credits from a RACE certified course, on Monday, October 2nd in the afternoon, we are providing a course called Heroes for Healthy Pets, an infectious disease management program. And my understanding is you will receive a certificate of attendance and it will be RACE certified. And so you can find all this information at petcareconference.com. So let's move back to our email contact slide. We've given Charlotte and Natalie plenty of time to start working through those questions, because with like 700 of you signed up for this class, there must be questions going all over the place. Miss Charlotte, do we have questions to start?
I do, Carmen, and Dr. Melissa, I'm going to try to, and attendees, thank you for being here. I'll try to get through as many of these questions as we can. If we do not get through them by the end of the hour that this is scheduled for, they are being sent to Merck, and Dr. Melissa will be responding to you all, um, uh, uh, you know, by email. Let's put it that way. So let me start. The first question I have, Dr. Melissa, is a 13-year-old Sheltie in a home where there are a bunch of Shelties on heart medication and arthritis meds and that sort of thing. Is the vaccine safe for
Right,
that?
for that dog.
Yeah, for a geriatric like that on other meds?
Sure. Yeah, so I mean, at this point, we don't, have any contraindications in terms of older dogs who are unwell in vaccination. So, in fact, I would highly recommend vaccinating those other dogs or that older dog for the simple fact that as animals get older, they tend to go through a phenomena that we call immunosenescence, which means their immune system starts to fade and fail and doesn't quite work as well. So because that older dog is exposed to other dogs who may be bringing in the influenza virus, I actually think it's very important to vaccinate that older dog, even if, they're unwell for other reasons. Vaccination should not necessarily cause problems in terms of interaction with the other medications. No vaccine is without risk, but the adverse events are extremely rare.
Okay, that sounds good. That may have partially answered the next question, which is for a litter of puppies who will be 7 weeks next week, 7 weeks old, how do you integrate the vaccine with their other core vaccines that they're taking?
Sure. So, I would definitely recommend you need to vaccinate for your distemper parvo and for your other upper respiratory diseases as well as influenza. So, especially with naive dogs, to make sure that you're not going to have reactions, I'd probably go ahead and start vaccinating for influenza after you've given them their first dose of their core vaccines. Probably with the next series, I'd go ahead and start the influenza vaccine.
Okay, that sounds great. Okay, then a question here. How is the importation of rescue dogs from Asia affected the outbreaks in the U.S.?
Sure. So we don't know for sure exactly. The thought process is that the March 2015 outbreak in Chicago occurred because there was an importation of dogs from South Korea. We don't know who or when exactly that occurred because, there isn't necessarily a quarantine for dogs coming in from South Korea. So we know that it was introduced that way. We just don't know exactly how. Does it continue to be introduced? Maybe, maybe not. But we know that the virus is here circulating and here to stay. So, it is now here. So the importation, bringing in more H3N2 isn't necessarily the biggest reason that we're seeing the flu virus. And I want to back up, too, to that 7-week-old puppy question. Also, I'd recommend, keeping them not only for influenza virus, but for things like parvovirus and exposure to other pathogens. Keep them isolated from other dogs until they've had a chance to get their full series of vaccines and form an immune response so that they can be fully protected.
Okay. Thank you. Another question, it's more of a comment, if you would, that this individual feels that people are afraid of the canine flu. Vet offices in their area are making people with possible, and you may have addressed this with why they have separate intake areas. In my area, vet offices in my area are making people with possible cases meet them outside their facility to treat them.
Yes.
Okay, so they're meeting them outside. See you outside the door. Okay, yeah. And then there are some comments here about they found some facilities that are singling out other facilities in smear campaigns, saying that first it's here, but first off, it's here to stay. So the question at the end of this comment is, why are vets acting so afraid? And if vets are acting this way, what hope do we as pet care or pet business owners have? And I think you may have addressed that with just how widely spread this can be and how long the virus survives.
Right.
There's a reason to be afraid. Yeah.
Yeah. Well, and I wouldn't necessarily, call it being afraid as much as call it being cautionary. When we get these respiratory cases that come into the clinic, we don't want to infect the other dogs, right? So that's why these clinics are seeing dogs outside. And it's not, with influenza virus, like I said, with respiratory disease in general, it's not always the flu. So anytime, even when we're not in the middle of an outbreak of canine influenza, whenever there's a respiratory case, a vet's office is going to operate under cautionary procedures. So it's just because they don't want to infect other dogs, and I think it's a very smart decision to do that if they do that.
Okay, thank you for that. On the dogs at risk slide, the question here is, why is boarding listed at the top? From a non-professional's perspective, it would seem that boarding facilities would be at higher risk.
Sure. Yeah. I mean, that slide wasn't necessarily in any particular order. Those are all risky situations for the possible transmission of influenza. And I mean, as you can see, our most recent outbreak was because of dog shows. Back in May of 2015 in Atlanta, it was doggy daycares. So they can really get it anywhere. I wouldn't necessarily single out boarding facilities, but definitely they are at risk when they go to a boarding facility.
Okay, very good. Do both the flu and Bordetella, canine cough, get transmitted from caregivers to pets, and will it survive on the shoes of the caregiver? Talking about flu and also Bordetella.
Yes, they both can survive on shoes, on clothes, on hands. Any part of your body, both influenza and Bordetella can survive on.
Okay, very good. Okay. Okay, here's, and this is something that folks in our industry deal with. They think about it daily, but how can pet facilities honestly battle against this? If one facility in a certain area has a pet with H3N2, how are they supposed to operate without closing their doors to let the virus run its course? And if closing their doors is the only option, then how can other facilities not pretend that it won't be in their facility almost immediately, causing the entire area? I mean, that's,
Right.
If they close their doors, people are going to find somewhere else to bring their pets, their dogs to.
Right. Well, I think there's a few different things that we can practice to help prevent that situation. One is to require vaccination, right? So if we require flu vaccines and if we require preferably intranasal three-way vaccines, but also other Bordetella option vaccines, then hopefully we're going to be in a situation where if it is introduced into our facility, it's going to be a very small amount, not for extended periods of time. So if it does happen to get into your facility, there are situations, unfortunately, where shutdowns are required. Shut down and disinfect really well. If it's possible for you to disinfect without shutting down, I definitely would do that, and that's going to basically involve, retracing everywhere that dog has been and disinfecting all the possible surfaces that dog has come in contact with, either directly or indirectly. And I just, and I don't think that we should sort of focus on a facility where it happens by pointing fingers and condemning them, because this is a virus, this is a bacteria. It's just part of natural biology, and it's going to happen to everyone at some point. So I recommend, like I said, requiring vaccination and practicing good disinfection, especially after you've recognized that you have a respiratory case, or if that dog has gone home and they call back a few days later and say, my dog's now coughing. institute good disinfection protocols, which we talked about.
Very nice. Okay. A question, do vets normally scan for the H3N2 when they see these types of symptoms?
So yeah, so that's going to kind of depend on the veterinarian. You know, if it depends. If your dog has been vaccinated, always contact the vaccine company because they may or may not be able to help out in terms of figuring out what's going on. But it's really going to depend on the veterinarian and what their protocols are. Some veterinarians will just treat what we call empirically, so they'll, you know, give treatment options that would work against most of the pathogens, but other veterinarians will want to run diagnostics. So, you know, if you want to run diagnostics, certainly request that when you bring your dog to the vet.
Okay. There's a couple of questions. Several people have asked a number of questions about different slides in your presentation. This person is interested in the canine pathogen slide that shows the incubation, survival, and shedding information. Is it possible to make that available to them, or is there a place where they can get that information?
Let me check into that. It might be possible. Since it has been approved. So let me check into that, and if they're interested in it, then we could certainly email them if they're going to be available. We could email the slide. Okay.
And then there's been several folks who've asked, will we have the slides emailed so that we can share this information with staff?
Sure. I think that's possible. Let me check into that, but I'm pretty sure that we can do that. So if they provide their email addresses, then we could provide them.
Okay. And I will also add to that that we have and are recording this webinar, and this webinar will be made available as a recording. We'll place links on the IBPSA website, on Facebook. It will be placed into the IBPSA video library, so there will be public places where you can link to this video, where you could use the actual video presentation to educate your staff with the video itself. Have them watch it. That way you have Dr. Melissa's comments and answers to these questions that they could be exposed to as well. So, okay, so let's see. And we're getting close. We have another minute or two of question time. Let's see. Okay, you covered disinfectants, you covered laundry detergent. Question on bleach, does the color safe bleach work? Does that have enough bleach? You know where they say it's safe on colors?
Yes, that should work. Okay. Honestly, when we're talking about flu, any kind of detergent or bleach is going to work.
Okay, that's important when you've got colored clothes that you're washing, so right. That you're wearing. Okay. You said viruses spread better in low humidity. They're asking for confirmation that that's what you said.
Yes. So the influenza virus specifically, they have shown spreads much better with low humidity environments.
Okay. Okay. Does Bordetella also spread easier in high or low humidity?
You know, I'm not sure that they've actually done the research for that. They've done the research for that with influenza because it affects people so much, and we see it more seasonally. But as far as Bordetella goes, I don't know that they've actually done the research for that.
Okay, very good. Okay, this is a good question. Is hand sanitizer effective against these viruses?
Against influenza, yes, hand sanitizer is effective. But against the non-envelope viruses like adenovirus, or if you're dealing with something like parvovirus, for example, it is not going to be effective. Alcohol doesn't really work against your non-envelope viruses. In addition, you know, when you put hand sanitizer, it is effective at killing out a lot of germs, but it doesn't remain long enough to kill some of the more hard to kill pathogens.
Right. Okay. Question, how can we encourage veterinarians in areas less impacted to stock/encourage the vaccine? Even if we want our clients to get vaccinated, if Okay, get vaccinated, even if they can't get it from the veterinarians, if they're not, okay, how can we encourage veterinarians in areas less impacted to stock and encourage the vaccine, even if we want our clients to get vaccinated, even if they can't get it or the veterinarians aren't supporting this, we can't get it done?
Yeah, so that's a little bit tough. I would definitely call your veterinarian and request it. See if they could even, special order it or supply it for you. I guess it's really the best thing is to contact your veterinarian and let them know that you want it, because they're not going to carry it unless people are going to either ask for it or agree to receive it.
Okay. Okay, I'm going to ask one last question because our time is up. And then the rest of the questions will be addressed and returned to you all by email. This last question is, if the vaccine is a live virus, and I think you said it was not, will that shed in my daycare environment? Does the dog need to not go to daycare during this time? So if they've been vaccinated.
Correct.
And
yes.
Yeah, okay.
So so the influenza virus is killed. It is not modified live, so it is not going to be shed after the vaccine is administered. The Bordetella vaccines, the intranasal and the oral ones, they are modified live. However, the amount of virus shed is very small, and it's not really going to cause clinical disease in other dogs. So I would always recommend vaccination. And, another way to get around that with the modified live vaccines, if you're really, really concerned, is make sure that they're vaccinated a week or two in advance before they come to board at the facility.
Excellent. Excellent. Thank you so much, Dr. Melissa. The questions that did not get addressed today, we will forward those to Merck, and the answers will be returned to you by email. If you have other questions that come up as you contemplate the presentation that you've been exposed to today, the email address of jill.lopez@merck.com. Jill will see that those questions are answered and returned to you as well. Dr. Melissa, thank you so much. Carmen, do you have some last comments?
I do. Dr. Melissa, we thank you for speaking to our audience today. I learned a lot, and I hope that our audience will go to the ibpsa.com website and listen to this again, because I think it will prompt more questions, and then you'll be able to reach out to Jill to get some of those answers. To all of you who attended today, thank you. We hope that you will join IBPSA in the future for more of these types of webinars. And Charlotte, Natalie, thank you for your technical expertise and filing through those questions. So without further ado, IBPSA wishes you all a safe and happy summer season, and we look forward to seeing you all at our conference and trade show in Jacksonville, Florida, October 3rd, 4th, and 5th. I believe this will be the end of the recording. Bye-bye.